Congrats, doctors, nurse practitioners, therapists. Guess what you get more of now? Paperwork! In case you missed it, CMS released an interim final guidance on how state agencies are supposed to implement work requirements for Medicaid. If you don't know what work requirements are, or any of the significant evidence that they don't work, check out this video I did last year. Since Congress passed the OBBBA, or as I call it, the one bloated bankrupt bill, there have been several estimates on how many people will lose Medicaid to pay for tax cuts for the ultra rich and increased funding for things like ICE and military. The Urban Institute estimates that by 2028, 10 million people will lose their health insurance due to Medicaid work requirements alone. And previous estimates have shown that the vast majority of people on Medicaid are working or should meet an exemption because they are caring for someone else or are navigating chronic illness. Upwards of 90% of folks. So what does this have to do with doctors seeing more paperwork? Well, the language of the OBBA provided an exemption for Medicaid work requirements if someone met the criteria of medically frail. Someone could meet that by being found to be blind or disabled, as defined by the Social Security Act, have a substance use disorder, have a disabling mental disorder, have a physical, intellectual, or developmental disorder that significantly impairs their ability to perform activities of daily living, or have a serious or complex medical condition. Now, initially, there was hope that state Medicaid agencies could use data already available to them to automatically determine if someone met the definition of medically frail. A group of state Medicaid medical directors laid out guiding principles in an article published in JAMA in May intended to help protect individuals with medical frailty from unintended loss of their health insurance because of work requirements. Those principles included that states should define medical frailty based on clinical risk rather than ability to work, that states need flexibility to operationalize medical frailty requirements, and that states should use a variety of data sources to identify individuals with medical frailty. However, CMS's interim final rule chose a very different direction and ties the medical frailty exemption directly to one's ability to work and not due to their clinical risk. So what does that all mean? States will not be able to use data they already have alone to determine if someone is medically frail. They'll need an auditable and verifiable way to establish that someone's medical diagnosis is impacting their ability to work. So congrats, doctors, nurse practitioners, therapists, and more. You get more paperwork. State Medicaid agencies will most likely have to create a form for a provider to sign and attest to someone's medical diagnosis impacting their ability to work in order for someone to meet the medical frailty statute in most states. So states have to figure out the process and forms and verification and storage of all of this information. Providers will have to figure out how to assess someone's ability to work and if they feel comfortable signing their patients' forms. And patients will have to make sure they are connected to a provider in the first place and then hope that that provider is able to fill out their forms for them. So if you care about folks getting the health care they need and deserve, especially those who are already medically vulnerable in our communities, this is all around bad news. Although this interim final rule goes into effect immediately, there is still a comment period. And so you can share your concerns through July 31st. So check out that link. And make sure, as we approach the midterms, that you are telling your elected officials that we know that Medicaid work requirements don't work, that one way we can love our neighbors is by protecting Medicaid, and that we are all just one bad day away from needing Medicaid ourselves. This is Dr. Nathan Chomolo, out here trying to heal our kids, communities, and healthcare systems. Take care of each other. Peace.